Uh, Good morning. Today we have 1-year-old child, and he's a case of bilateral complete cleft lip cleft palate. And we did his primary lip and nose repair around 8 months back when the child was around 4 months old, and now the child has come for the palatoplasty. So we have a bilateral cleft palate defect here, and we are doing palatoplasty today. But today I am going to talk about the lip because especially bilateral cleft lips are difficult cases, and recreating a normal looking lip is a challenge. So here you can see we have done primary cleft lip repair, and we have recreated a cupid's bow because the shape of cupid's bow gives them a normal looking lip, and that is very important in bilateral cleft lip repair, that we should try to recreate the normal looking lip. So the cupid bow has a major role in giving a normal shape to the lip. So with our modified Millard technique we have recreated, and his lip result is outstanding, and today we are doing his palatoplasty. Thank you.